Good afternoon, everybody. It's a pleasure to be back with you again for another one of our live feeds. I hope you find today's topic of interest. The topic is IVF with egg donation. I'd like to say that if any of you, upon your own discretion, choose to have a consultation with me, it would be by Skype. And if you want to talk to me, would you please contact my concierge? Her name is Julie, and she's reachable through her email at julied, Julied, at shareivf.com, or call her directly at 702-533-2691. That's her cell phone number, and you can reach her anytime you choose. You can also reach Julie by calling 1-800-780-7437. Now, my website is www.shareivf.com. If you go to the website, you can find the little icon for the blog. Click on Dr. Scher's blog. It'll take you to the numerous articles that I've written there. And there's a very extensive article on IVF with egg donation. So go there and read up on that article for more detail on the very topic we're going to talk about today. Okay. IVF with egg donation is one of the fastest growing indications for the performance of in vitro fertilization in the entire ART arena. This is in large part due to the fact that more and more women are delaying childbearing in order to fulfill their professional aspirations, and are putting off having a child to a point in their lives where, due to natural physiology, there's a decline in the quality of their eggs and the number of eggs they can produce. As a woman gets into her 40s, most of the women begin a process we refer to as the climacteric, which is the 7 or 8 years before the onset of menopause, when ovarian function declines and the woman starts running out of eggs. As she gets older, fewer and fewer eggs will be available for in vitro fertilization harvest. And what's more, because those eggs have been in the woman's body all her life, through wear and tear over time, a smaller percentage of those eggs are likely to be chromosomally and genetically competent. So, for reasons of declining egg quantity with age and proximity to menopause, and declining egg quality, most women find it more difficult to conceive, and those that do have a higher risk of miscarriage and indeed certain birth defects like Down syndrome. And for this reason, most of the women that seek IVF with egg donation are beyond their 40s. Some are younger, because some women, in fact, can go into premature menopause or premature ovarian failure at any age. Some are born without ovarian function. Although that's rare, there are conditions like Turner syndrome where that happens, and where there is no other choice but to use egg donation if you want to have a baby. Another common indication for egg donation are same-sex couples that are choosing to have children, especially when it comes to the male partner, where the egg donor provides the egg and then the male partners apportion their sperm or choose one or the other to produce the sperm that will fertilize those eggs for transfer into another third party known as a gestational carrier. That is also very common. And in other situations with same-sex female partners, where both partners have advanced well into their 40s, which is often the case, we will see a need or a request for egg donation. Now, there's little doubt that IVF with egg donation yields the best possible results that you can get. The reason is that the eggs are younger, and younger eggs are more likely to be chromosomally normal. And young women, young donors, usually provide more eggs and make them available to the couple or to the individual for fertilization and transfer. So when it comes to doing IVF with egg donation, how does the woman access eggs? Well, until quite recently, the only way to access eggs was through an egg donor, a third party. Most women would gain access to the donor through a third party agency, such as the one I use called Footsteps to Family. And you can actually look them up on the web. It's called footstepstofamily.com. So either you get your egg donor fresh, healthy, fresh young woman from an agency such as Footsteps to Family, and there are many, many others, or you can today get eggs from an egg bank. A little word of caution. Obviously, getting eggs from an egg bank where eggs are categorized so that people can go to the website and choose a profile of a donor, know more about the donor, and then select their eggs is an easy way to go. But the problem is that success rates using donated eggs that have been frozen are significantly lower than when fresh donors are used to provide those eggs. My preference, without a doubt, is still to favor the use of using fresh donor eggs rather than using eggs from an egg bank. One of the problems with the eggs from the egg bank is that each egg you purchase from the egg bank is probably got no more than about, I would say, a 6 to 8% chance of producing a baby. And so the chances of success are very much reduced. Now, what are the characteristics you'd look for in the ideal egg donor? Well, firstly, age is important because age affects the quality of the eggs, their chromosomal integrity. And so my preference is to always suggest a donor under the age of 34 years, ideally. The second preference would be that she be over 25, because with very young donors, they often tend to hyperstimulate, and this has an adverse effect on the quality of the eggs you harvest. So 25 to 34 is the ideal range. The third option that you should be looking for, although it's not always available, is someone who has been through IVF before as an egg donor and therefore has proven by track record how she can perform. The next one would be to choose somebody that at the very least has been pregnant before and therefore has proven her ability to achieve a pregnancy with her eggs. And I guess another factor in choosing an egg donor would be to choose somebody that you know is having regular menstrual cycles, someone who's probably ovulating. Now, this is the order of preference I've given you. It's hardly likely that you're going to always be able to find someone that meets all those criteria and on top of it meets the physical, ethnic, racial, religious criteria that many people set as well in selecting their donor. But you should try to look for as many of those characteristics as I mentioned. So then what is the process? How is this done? Well, there are two ways to do IVF with egg donation when you use a fresh donor. The one is to synchronize the cycles of the recipient with that of the egg donor. And to do that, both parties get placed on a birth control pill. And then when they've both been on the pill for at least 10 days, and obviously because cycles begin at different stages, the one will have been on the pill longer than the other, then you can overlap them with a drug called Lupron, which is what I routinely do. Stop the birth control pill after 3 days of taking both Lupron and the pill, and then the period will ensue within 4 to 7 days. As soon as the period comes, at that point you'll have the donor and the recipient usually within a day or two of one another. The donor starts receiving injections of fertility drugs to propagate the production of eggs in little fluid-filled spaces called follicles. The recipient, in turn, receives estrogen injections to build up her lining, and that is monitored through the performance of ultrasound examinations and measurement of her blood estradiol. The donor, of course, is also monitored similarly, watching her estradiol and the growth of her follicles. And at the right time, she's triggered with a drug called HCG, Profasi, Pregnal, or Novarel are examples of this drug. 10,000 units is given. The eggs are then extracted 36 hours later with the donor under conscious sedation. The eggs are then fertilized with husband's sperm, and the resulting embryos are then available for transfer to the uterus of the carrier some 5 or 6 days later. So the carrier gets estrogen injections up to virtually the point that the donor undergoes the egg retrieval, and then the carrier, the woman to be the aspiring parent, will now get, in addition to estrogen, progesterone administered to cause secretory changes in the lining of the uterus that make it more nurturing for the embryo. And then up to two embryos, resulting from the fertilization of the donor eggs with husband's sperm or partner's sperm or donor sperm in certain cases, having reached the blastocyst stage 5 or 6 days after fertilization, are then transferred to the uterus. The pregnancy rate is very high, should be around 50-50, and the baby rate around at least 40% in ideal circumstances. Per transfer of up to 2 such blastocysts to a recipient that has been properly prepared and properly screened to eliminate factors that could interfere with the embryo's attachment, such as anatomical abnormalities in the uterus, scarring or polyps inside the uterine cavity, or immunologic problems that could interfere with implantation. If these are dealt with, the success rate is much higher. Now, this is the conventional way in which IVF with egg donation is performed. Of course, there's a lot of hormonal support given to the recipient after she achieves a pregnancy, diagnosed about 8 days later, and repeated by a second blood test 2 days thereafter to confirm the pregnancy hormone levels of HCG are rising. And then for the next several weeks, the recipient is going to receive hormonal supplementation of estrogen and progesterone until the pregnancy can sustain itself at around 7 or 8 weeks. And at that point, the pregnancy is autonomous and the woman can go on without further hormonal supplementation. But this is the common conventional way. Obviously, from what I've told you, it takes a lot of coordination. There are a lot of complexities. And this can, of course, be avoided if you do it a different way, the way I am now favoring for my patients. And that is by preparing the donor completely separate from the recipient, doing all that I told you to harvest her eggs, fertilizing those eggs with the husband or partner or donor's sperm that's designated, and then allowing the embryos to develop to the blastocyst stage, where there are over 100 cells, and then vitrifying them, which is ultra-rapid freezing. And this process of vitrification protects the embryo from ice crystals that otherwise would form inside the cells if you did the conventional slow freezing method, which is now outmoded and outdated and replaced by vitrification. Vitrification freezes the embryo 60,000 times faster, and as a result, the embryos are not damaged by ice because there's not time for ice to form with that rapid a freezing process. And then we can freeze it and store it. Because the freezing does not damage the embryos, and because 90% will survive the freeze-thaw in as good a condition as the day they were frozen, it allows us to store and bank the embryos till the recipient couple at their own leisure are able to come in and be prepared separately for a timely transfer of the embryos in a frozen embryo transfer cycle arrangement. This is far more convenient, it doesn't cost any more, and it also removes a lot of the concerns. What happens if the donor, for some unknown reason, doesn't produce embryos with husband's sperm and there's no transfer? The couple have been synchronized with the donor for no reason whatsoever. So for all of those reasons, I now prefer I now recommend to my couples that I treat that they preference using frozen embryo transfers with what I call staggered IVF, which means that the embryo transfer does not take place in the same cycle in which the eggs are harvested and the woman is stimulated. The other way, of course, is to use the third option, which I've told you I don't favor, but is still available, which is using eggs derived from an egg bank. This removes the complexities as well, but in my opinion forces you to settle for a lower pregnancy rate using this approach. Okay, So that's how the process goes. Now, it's important to understand that there are two ways of choosing donors. Either you choose an anonymous donor, which is the preferred method, because you don't have someone in your life, you don't know who she is, she doesn't know who you are, and so there's no interfering factor. I've had people tell me where they've used known donors that when the woman who is often a friend or a family member comes to visit with them and looks at the baby, they wonder in their minds as to whether she's not looking at this child saying, "Isn't that my baby?" And of course that can be very distracting and emotionally disturbing. I therefore feel it's a very good strategy to always use an unknown, anonymous donor that's been selected from a pool of donors through an egg bank. So through an ovum donor agency. So how long does this process take to get going? Well, from the time you've selected your donor till the time you know if you're pregnant should not take more than 2 months. If you include the time for selecting of a donor, that adds an unknown, because some people find a donor immediately of their choice, and others have to stick around looking and searching for the donor that meets all their personal criteria and is well suited to them. So this then, in a nutshell, is what IVF with egg donation involves. Cost is a factor. You can probably look at about $20,000 to $25,000 for all the costs involved in doing IVF with egg donation, be it with a fresh egg donor or with frozen cycles. Probably a little bit lower if you use an egg bank. But the truth of the matter is that the cost is not the cost of a procedure. The cost is the cost of having a baby, and that cost comes in two currencies. It comes in the form of financial cost, and it comes in the form of an emotional outlay and an emotional cost. So always look at the cost as the cost per baby, not the cost of a procedure. And that's why I still feel that in the final analysis, it's probably less expensive to use a fresh donor, be it using frozen or fresh embryos. So the cost is a big thing, and this is one of the reasons why some people today go outside the country to do egg donation. They'll go to Spain, they'll go to the Czech Republic, they'll go to South Africa, they'll go to Australia, where the costs are less because the donor gets paid less and the cost of IVF is less. I think this is probably not a bad thing, but it's always better to stay, I think, with those programs and those centers that, you know, very oftentimes in these outlying areas, outlying countries, you share eggs with somebody else. So not all the eggs belong to you, and you have to take what you get. So I'm not very much supportive of that concept, although it is a reality that many, many couples are now using medical tourism to access donors and IVF with egg donation outside of the United States. So that then is my contribution for today's feed. And just before I leave you again, please, if you would be so kind as to text out to those people you know that have contacts with you, and tell them to come and look at this live feed on Dr. Jeffrey Scher Facebook, and also call Julie, my concierge, at 702-533-2691 if you'd like to have a Skype consultation with me to discuss your case in detail, or go directly to my website, scherivf.com, and then to the blog and read the blog article, and you can even register online on that site for a Skype consultation with me. Thank you so much for attending, and have a wonderful day.